Well, I welcome you. We'll call the meeting to order. Now that we've got the recording going, I hope that everyone is doing well and in good health. I'm going to ask everyone to mute themselves unless you're speaking to avoid echoes.
I'll mute everybody.
Okay, you can do it.
Yeah, I'll mute everybody.
So let's mute everybody. Okay. So we have two components of the consent agenda, and since we're in the Zoom world, we'll try to do it the way we've done in the past. We have the approval of the agenda for tonight, and if I do not see any objections, I will accept the agenda. So if you have concerns, please voice them now. And similarly, we have the minutes from the February meeting. I'll call for any questions, deletions, punctuations. I see Patricia, are you raising your hand? Okay, please unmute and voice your.
I just wanted to correct, my graduate degree is from Columbia University in New York, the School of Nursing. And then we refer to the University of Illinois College of Nursing, where I taught.
So Mike, you have those, make those corrections? Okay, thumbs up.
Thank you.
Any other additional corrections or suggestions? Okay, not hearing any and not seeing anyone's hands raised. And feel free to use the electronic hand if you know how to do that on the Zoom. I will accept these as submitted with the corrections that have been brought forward by Patricia. Our first order of business is to have another presentation from Jen Davis. I'm honored that you're here, and look forward to learning more about the Communicable Disease Surveillance and Control Program and the clinics and settings. So Jennifer, I'll turn it over to you.
Thank you, everybody. Actually, we have Amy McManus, who is our communicable disease interventionist. So she has put together a presentation. She joined our department, is it October or November, Amy?
November.
I'm sorry.
Okay.
And she's been a wonderful asset to our department. And I'll let her tell a little bit about herself, and then I'll share my screen. So this is Amy.
Hi, everyone. Like Jen said, I'm Amy, communicable disease investigator here at Skokie Health and Human Services. And also, as she mentioned, I've been in this position since November 2022. Prior to that, I was at UIC, Department of Emergency Medicine, as a program coordinator working on HIV screening and linkage to care in the ED and urgent care settings. And prior to that, I was at Cook County Health, where I was in a few different roles. I'll go over what we do here regarding communicable disease at Skokie Health Department. Jen, if you want to start the slides.
Absolutely.
And Jen, if I forget anything, feel free to jump in, okay?
No worries. Let me see if I can start the slideshow. Oh, here we are. Okay. Are you able to see my screen as a slideshow or as
I see, right now, I think I see it as a slideshow.
Okay, beautiful.
So next slide, please. So our work here in the department in communicable disease investigation and control involves the following. We do daily reporting and investigation of reportable communicable diseases within our jurisdiction. These are received through three main channels. The first is INEDS, which is the Illinois National Electronic Disease Surveillance System, which is an IDPH database. Most of the reportable communicable diseases come through that database. HIV case reports come through an electronic file transfer system called MOVEit, which is also an IDPH product. And syphilis reports come via fax. I know that IDPH is in the process of revamping the reporting system, and supposedly syphilis and HIV will soon join all of the other diseases, and they will be all in one place, which will make it a lot easier. When we receive these reports, we do some investigation, and we update the case report forms in INEDS and the HIV or syphilis CRFs through their particular channels. And to do this, we reach out and conduct interviews with providers and patients regarding treatment and linkage to care, and we provide them education and guidance if needed. Right now, our most common case reports that we're receiving include chlamydia, gonorrhea, chronic hepatitis B and hepatitis C, and SARS-CoV-2. Other recent, though less frequent, communicable diseases include HIV, hepatitis A, syphilis, varicella, and Shigella, as well as some others. We work with schools, daycare, and long-term care facilities and asylum seeker populations in our jurisdiction when there's an instance of communicable disease in their population. Jen will talk a little bit about this in a minute, as she is the primary contact for that type of work. We do disease outbreak surveillance and investigation, which is part of that. And we also meet frequently with local health department staff in other jurisdictions and IDPH to discuss hot topics, best practices, case studies, and emerging threats. Next slide, please. And I just wanted to go over sort of the mechanics of case reporting in INEDS to give you an idea exactly how that happens. So like I mentioned, we receive daily reports of reportable CDs from our jurisdiction in this portal, INEDS. These reports have been entered into INEDS by labs or providers based on positive test results. So when they get a positive test result, if it's a reportable disease, they are required to report it in INEDS. IDPH channels the Skokie ones to our jurisdiction, and we receive the reports for individuals who live in Skokie, and for those with positive chlamydia or gonorrhea results, if their test result happened in Skokie, even if they live in Chicago, we'll receive those reports. We determine whether the case requires investigation or follow-up. We call providers, and if necessary, we reach out to patients to answer the following questions. Is this a case of X or not a case? And we base that on the CDC case definition. So if it doesn't meet the case definition, it is considered not a case by IDPH, and we mark it as such in the CRF, in the case report form. If it is a case, we ask, is this a new case or a chronic case? Is the patient aware of their status, and are they linked to care? Are they in treatment? And if so, what treatment? Based on these answers, we update the case report form and close the case reports in INEDS after our investigation. These are all reviewed by IDPH. And here are some numbers as to January and February of 2023, the most common reportable diseases. I'll just let you have a look at that.
I think it's important to note that if you're looking at hepatitis B and C, those are very complex diseases. So we receive all 23 notifications, and then Amy does her investigation to determine, is this a chronic case or are these newer labs that have come in? And of those labs, many times if they're just running titers to see immunology, it's not a true case of hepatitis, but we receive the increased antibody result. So a lot of time goes into researching each of these diseases. And luckily, for hepatitis B, confirmed new cases was 0, but she still had to filter through and investigate 23 cases that came our way. And then for hepatitis C, we've had 2 new cases for February, but it's still a lot of investigative work that goes into these.
And thanks, Jen. And a lot of the hepatitis B cases, because we have a really diverse population here in Skokie, a lot of those cases are chronic hepatitis B cases that the individual maybe got in their home country, and so they're often Asian populations who have hepatitis B and come here, and they're having new labs run with their providers, and these labs show up in INEDs, and that's when we receive them. So that is what a lot of those numbers reflect. Next slide. I don't know. Any questions? Does anyone have any questions?
I wondered if you saw, it didn't give a numerical for shigellosis. I know there's a concern now nationally about a highly antibiotic resistant strain of Shigella. Have you seen any of these in our neck of the woods?
We had a recent case with our asylum seeker population. It was a young girl who had a case of Shigella, and her father was determined to be a food worker. So we are in contact with Jen. I don't know if you want to talk about that. You handled that case as I was out of town.
Yep. So we provided care coordination, education to the family and the site. And through the case management, the young girl received the antibiotics with no issue. She did already release her 2 specimens that showed a negative result. So the antibiotics did work without an issue. Her father was also determined to be free of any disease. And so we were able to successfully case manage with the site and provide the coordinated care for them.
Thank you.
Absolutely.
Dr. Werner has a question.
Yes.
Yeah, Amy, you do heroic work. And I say that from the point of view, when the pandemic started, I volunteered with the health department to do contact tracing for positive patients that had tested. And it was not unusual for me to run into a dead end where either the patients would not cooperate, they wouldn't talk about their contacts. And it was frustrating. We were very stymied. When you encountered that, what next steps can you take?
Yes. Well, you do heroic work too. That luckily hasn't been, since I've been here, hasn't been very common, although it has, I can think of one case where there was a 20-year-old who had a rabies exposure. And she, according to the case report, she had gotten some of the rabies vaccinations, the post-exposure vaccinations. I reached out to the provider to get some information to fill in the case report form, and I reached out to her because there was a discrepancy as to what animal she was exposed to. And I called her a number of maybe 5 times and left voicemails, and she never returned my call. And because we had the information that we had in the case report, we eventually closed it. But I would say the majority of people been lucky that they'll return my call. And between providers and patients can usually fill in the blanks to the satisfaction of IDPH and to us as well.
Okay, thank you for that
Thank you.
answer. Dr. Werner, any other questions? Now, if anyone else has any questions, please use your electronic raise the hand function, because when the share screen, I can't see you. And I don't want to avoid acknowledging your question.
I'll give just some information about outbreaks and providing education to our congregate care settings, long-term care, schools. So we have regular communication with all of our school nurses. And so they are very aware of what cases are reportable per IDPH standards. And if they have any questions, they very freely reach out via phone or email to any one of the nurses here to ask questions or gain clarifications. They are many times our advocate for the kids. They will call us to set up vaccinations if needed, or help to get information to the families in regards to education to whatever disease that they are dealing with. So through our open communication lines, we're able to reach everybody that needs, for the most part, everybody that needs any support and care.
Again, thank you. Any additional questions?
Okay.
Well, very good. I'd like to thank Jen and Amy for keeping us up to date about this important work. And as you can see, there's a lot of activity that goes on, and we intend to keep you informed as we move forward, with our meetings in the future. We're at the point now. Pardon me?
Dr. Lynn, you mind if I just jump in and introduce? There's one more Health and Human Services staff member on the meeting, and I wanted to introduce him, just so everyone's aware that the strange gentleman named Garrett Reynolds that happened to join us that isn't on the Board of Health. He's one of our, he's a public health intern that has been working with Liz Nelson on the I-Plan, and also been helping Jen with some of the medical reserve core stuff. So Garrett, I don't know if you want to I don't know if you can unmute and give everyone like a 30-second introduction, or if there's anything else you want to share about where you're going to school. And Garrett, are you there?
You have to
I see
unmute.
his picture. I see his picture, so I know he's here. But maybe later on, if Garrett can unmute, he can introduce himself. But I just want to let you guys all know that he's here. He'll be here for the next 2 meetings at least.
All right, well, thank you. So speaking of introductions, we're at that point in the meeting now when we are going to hit, we were supposed to have, again, we're trying to do 3 people. I know that one individual, I don't see that person on the Zoom. So that was our third, but we do have 2 people who were going to introduce themselves. Unfortunately, Mike, I just glanced over the emails today, and who are those people?
So yeah, so I have 2 individuals that have offered to introduce themselves, and that would be Juliet Hato and Maureen Hanlon had mentioned that she could also introduce herself. And then Dr. Williams was scheduled, but I don't see him on tonight unless I'm missing something. So maybe we can start off with Juliet and then move to Maureen.
Excellent. Oh, there's Garrett.
Yeah, sorry about that. I was trying to I had my headset in as I was listening and trying to eat dinner, and it wasn't turning on when I was trying to get it to turn on. So, hi, my name is Garrett. I'm an MPH student at Purdue currently. And I am doing my internship at the Skokie Health and Human Services Department. And so far, it has taught me a ton of information. Amy, Mike, Jen, and Liz, who I believe is in here too, have just been phenomenal with showing me the ropes and how the department operates.
Well, thank you for introducing yourselves. Now we'll go back to Juliet. Hello, how are you?
I'm good. How are everyone doing?
Very well, thank you.
So I'm Juliet Heidel. I'm a registered nurse. I currently work at the North Shore University Hospital. I actually work for the cath lab. I've been there for about a little over 10 years. Used to do procedure work. Now I transition into the registry nurse coordinator, where I collect a lot of data and do a lot of quality with the cath lab and the interventional cardiology department for all 4 North Shore hospitals. I have actually resided in Skokie for the last little over 10 years. I originally, my background is in cardiology. I've been a nurse for about 14 years. I am originally from Little Rock, Arkansas. So this was kind of a big move for me. But I have kind of acquainted very well. I joined the Board of Health about a little over 5 years ago. They wanted someone a part of this Aryan community since we have a large population here in Skokie. So I've been here just trying to be a voice and see what's going on and kind of translate everything over to my community so they're all aware health-wise what's going on in Skokie. And if they need any help with anything, they know I'm here and I got all the information.
Well, thank you very much for introducing yourself.
Sure.
And for what you do.
Thank you.
So who was the next person who volunteered?
It was Maureen Hanlon.
I can't tell if Maureen's on the.
Was she the person on the iPhone?
I thought it was a doctor of some sort.
I thought Maureen was on the iPhone. Who is on the iPhone then? I'm sorry, I can run them.
Dr. Shim.
Ah, okay. So I guess Maureen isn't here tonight. Does anybody else want to nominate themselves and introduce themselves? We have two spots available if anyone wants to step up to the plate and.
Okay, I can introduce myself.
Awesome.
So my name is Kyungnan Shim. I've been living in Skokie for about last 30 years or so. My parents moved to Skokie, and then this is where I actually met my husband. His family also lived in Skokie for 30 plus years. And after we got married, had 2 kids, we moved to Skokie to raise the children, which has been, and that's been great. And I'm still here. I was very happy with the education my children received. Fairview South was wonderful. And they both had very good experience at Niles West. And now one of them is in osteopathic school in Oregon. The other one is working for a law firm, and he moved back to Skokie with us. I've been a member of the Board of Health for, I think, about 5-6 years. I'm currently working at Cook County Health. So I know Dr. Lind, you retire from here. And so I am in the Division of General Internal Medicine. I have primary care clinics at GMC, which is next to Stroger, as well as Providence, which is next to University of Chicago. And my primary interest is in colon cancer screening. We start screening at age 45, and also smoking cessation. Both my parents, my mother and father, died of lung cancer recently. One was squamous cell CA. My dad used to smoke. He quit over more than 15 years. And my mother had adenocarcinoma of the lung, and she never smoked. So that's what I'm very passionate about. And one of the main reasons that I joined is that because I've been so fortunate to live in Skokie, I want to see if I can, contribute to the health of overall community. And sorry for not having the video on. I'm sorry, but I'm actually driving while talking.
Well, we thank you very much for your willingness to step in on short notice. And I personally want to thank you for all the good things that you do. And I know what life is like very much in your world, and I'm most appreciative. So we actually have another volunteer, Swapna Devi.
Hello, yes, thank you. Hello all, I'm Swapna Dave. I am a Skokie resident for actually over 20 years now. I am a primary care physician from India, and I moved I'm born and raised in Mumbai, India, and I moved actually to the US and to Skokie in the same house that I live in over 20 years ago, and to be with my husband. And I've been very passionate about public health. So I pursued a master's in public health from UIC, and since then have been working in research and the public health world. So my largest tenure was at Northwestern University, where I worked on multiple research studies on prevention and heart disease prevention, and also understanding the epidemiology of the disease. And since then, I actually currently work at a pharmaceutical company, Merck, and I'm continuing kind of my journey in the research world, and very interested in understanding, how research, in the pharmaceutical industry works in the oncology field at this time. I joined the Skokie Board of Health because I'm very passionate about kind of being in the community. I'm very engaged in the Skokie community, and also very much so in the South Asian community, which is, the Indian, Pakistani, Bangladeshi community. So I actually volunteer at the temples, and I'm in the community a lot. And that's where I thought, this is a great opportunity to be at the Skokie Board of Health, and then learn the information and then bring it back to the community where I'm, I still continue to volunteer. I also am on multiple South Asian boards as well. I have a daughter who goes to school here in Skokie. She's a junior at Niles North High School. And my husband is a pharmacist who works at Walgreens. And we've been in Skokie for a long time, and just love the community and, the diversity, and happy to be here. So thank you.
Well, thank you very much again for be willing to respond on short notice. And again, I thank you for all that you do, and it just shows you the interesting, diverse, and the backgrounds of individuals who are on the board, and I'm most appreciative. So, Mike, we have our three today. I guess we'll reach out to Dr. Williams and find out. This is not the second meeting in a row that he was unable to attend, but I'm sure he'll want to introduce himself at the next one. For those of you who care, and I know that as an alum of the University of Illinois, as a undergraduate, the University of Illinois is living up to my expectations. And so with 2 minutes and 27 seconds to go, they're down by 9 points to Penn State. And it's looking bleak, but that's what happens. So we'll move on now. I have a very brief report. And when I try to look at what is important from public health spectrum, COVID continues to preoccupy most of the reports. I have read some encouraging things and some opinions on the fact that we're probably approaching what we would define as an endemic. And the cases, and again, as you know, it's very hard now to identify cases because of lack of reporting and the fact that people aren't being tested in labs that are obligated to report. But looking at wastewater across the country, and most importantly, looking at hospitalization, things have somewhat plateaued. We're not seeing any big spike. Most interestingly, and probably most importantly, is that the Omicron variant appears to still be persisting. We're in the XBB 1.5 is the predominant across the country, but still considered to be Omicron, which is really different than in the past years when there was a new variant coming up, very frequently. And so that bodes well. Also, recent data has been very encouraging that the bivalent booster has been very effective at preventing severe disease and hospitalizations. And also Paxlovid is still an effective pharmacologic agent. Unfortunately, the biggest problem is those people who are over the age of 65 and people who are immunocompromised and make up about 90% of the mortality and severe disease. So that really brings us to the question. And I know that I've read again that when the health department puts out their information in the Skokie News and the e-newsletter that we receive on a regular basis, urging individuals in these high-risk categories to still be careful and to get their booster vaccination if they haven't done. As you probably know, it's been well publicized that it's expected to have a new vaccine in the fall, which will be multivalent. It's uncertain as to what the formula will be at this time. The only big question right now is whether those high-risk individuals, based by age, medical conditions, who receive a booster sooner than the fall, because it appears that immunity, at least humoral immunity as we can measure it, so antibodies, will fall off, and we were reaching the 6-month period when the vaccine first came out in September. So that's something that we're kind of waiting to see. And I know a number of professionals on an individual basis are advising high-risk people to get revaccinated. But that's not a public policy decision, or it's not an FDA decision at this moment. It is still on an individualized basis. Some new and exciting data surfaced in the last week, which I thought was really phenomenally encouraging, and that it appears that a very well-known and inexpensive drug, metformin, has significant benefit in those people who were treated with metformin to prevent severe illness. And actually, the performance based on the original studies make it look pretty stellar. But as we all know, we need more studies, and these are going to be ongoing. But that would be a very important strategy because it is a very well-tolerated, inexpensive medication that was, developed for diabetes, but appears to have a antiviral benefit. As I said, we're waiting the new decisions on the vaccines. In the news front, which I think is also encouraging, it looks like we will have a available RSV, respiratory syncytial virus vaccine. And this is especially important in young children and older adults. It has been recommended by the ACIP committee to move forward with the vaccine based on the preclinical trials and the clinical trials that were done that shows that it is effective. And lastly, and one that it just came on my radar screen is kind of a testimony to what the anti-vaxxer movement has succeeded in doing, and that's polio. As you know, there have been basically around the world 2 outbreaks that were of concern. One was in New York and the other in the United Kingdom. What's interesting is that these viruses that were causing disease appeared to be a result of the oral polio vaccine. So just to review for you, the oral polio vaccine is an attenuated virus, and this virus mutated into an infectious state. Now, what has been shown by wastewater evaluation is that there's a lot of polio in people, but they're not getting sick. And the reason they're not getting sick is because we had such a high vaccination rate. And unlike COVID, the vaccination appeared to result in long-term immunity. However, in certain populations where vaccine wasn't available, because either people were anti-vaxxers or they maybe come from parts of the world where maybe they didn't have the availability of the vaccine, these susceptible individuals have become infected. These are not large outbreaks. This is not a major public health threat at the moment, but it raised a lot of concern. And so I know a committee out of the University of Maryland, being led by Robert Gallo of HIV notoriety, is looking at this. And one of the suggestions may be actually a combined vaccine, which would combine both the oral and the parenteral vaccine. And that's probably, as a child in the 1950s, that's how we received it. We originally received the Salk vaccine, which is injectable, and then it was followed later by the Sabin vaccine, which was oral. Salk vaccine is a inactivated virus, and it generates an immune response that protects you from severe disease. Whereas the oral polio vaccine is one that protected the gastrointestinal tract, and that's how we acquired the virus. So you get double protection if you've been vaccinated with both. And I think that's what they're looking at the moment. And so time will tell whether this becomes an issue, but again, it just shows the importance of maintaining proper recommended vaccination schedules. And it becomes a public health issue when you have enough individuals that now are vulnerable because they will in fact become sick, and they will in fact now become infectious. And we will wait and see. So that's all that I have. And at this point, I'd like to turn it over to Mike for his report.
Thanks, Dr. Lin. Does anyone have any questions for Dr. Lin? If not, just give me a second and I'll pull up the presentation. One second, I'm gonna move some stuff around my screen. Share my screen. Okay. Can everyone see the presentation? Is that a yes?
Yes.
Okay, great. Okay. So I also don't have a ton of updates for tonight, but I'll talk a little bit about some COVID data local at least. COVID cases in Skokie have actually increased slightly since our last meeting on February 9th. And this, of course, I think Dr. Lin alluded to this earlier, but the data that I'm using is solely based on the Illinois Department of Public Health Salesforce data. And that's only cases that have been, or lab cases that have been sent to an actual certified lab. So, and we all know for a fact that a significant percentage of individuals are testing via the at-home antigen tests, and they are very effective tests these days. So people aren't going to Walgreens or other providers to get tested as often. So, but it has increased slightly. Our COVID-19 community level for Cook County is still considered low though. And that's just because the community transmission rate for Cook County is below 200 cases per 100,000, and our hospitalizations are low. And you don't see the burden on our hospital system that we've seen at different points in the pandemic. For Skokie specific data, We, as of today, we were at about 137 cases per 100,000 individuals in Skokie. This has increased. I think we were right around a little bit over 100 the last time that I presented to you. However, keep in mind statistically, it's more difficult to assume that because our cases went up slightly since the last meeting that anything's worse or better, simply because we just don't have hundreds of cases anymore. We have 13 cases a day. So I think we had one day within the last month where we had like 30 cases, or there was some spike for some reason. And anytime you have a single day spike, it could create all sorts of abnormalities or difficulty actually reading the data correctly. So I prefer actually as much to look at the Cook County data because it's a larger data set. In Cook County right now, their cases per 100,000 are below 100, which is good news because it's nice to see cases that low for now. Eye care data. I didn't update. I meant to update this prior to the meeting, but our eye care data, we're still right around the 30% bivalent booster rate for Skokie residents. I think I talk a little bit about this later on in the presentation, but we know that with the May 11th emergency declaration looming, we've had some internal discussions about making sure that we push out as much information to the public, especially those that may be underinsured or may be uninsured, that we should have accessible vaccines available through the Health and Human Services Department, at least through May 11th, and most likely beyond that date because there is a stockpile of vaccine. There has been some news that Moderna will continue to offer a vaccine through some sort of process to the uninsured still, but I don't have all the details on that yet. We also have plans on participating in neighborhood events. We have been partnering with the schools. I think at District 69, we've held some clinics. We're still doing homebound. So, but our goal is to get as many people what's considered up to date on vaccine, which would include the bivalent booster as possible. We've administered over 34,000 doses, and we have about 23,514 cases of COVID through yesterday in Skokie. This is a 7-day chart showing the 7-day moving average, and as Dr. Lin had mentioned, we've plateaued. You know, I mean, ever since the beginning of January, which we saw that spike right after Christmas, holidays, we sort of have seen it. This is Skokie data again, which has a little bit more variability, and I'll show you the US data in a slide or two, but we've more or less plateaued off, with some experts saying that we've hit a more endemic mark, but we're still seeing cases. This is the community transmission rate or level. This was something since the onset of the pandemic, they had said that anything over 100 individuals per 100,000 population was considered high. This transmission level is still used as part of the CDC's community level, which measures the transmission rate plus hospital admissions and hospital data. But as you can see, we're still high at about 137 cases per 100,000. This is the US case rates for deaths in weekly cases. And you can sort of see in the weekly case rate how it's sort of leveled off and plateaued. You don't see as much variability with the weekly cases as Skokie, but you know, it's sort of just, it's steady Eddie at this point with cases. And certainly since January of 22, we haven't seen as many deaths either. That's sort of plateaued too. Some other updates from the Health and Human Services Department. Position wise, we are close to hiring a new social worker. This individual, I can't give you her name yet. She has to pass one more hurdle, but she's a licensed clinical social worker. She'll be working at at Village Hall, providing short-term case management, linkage to services, as well as our other human service programs. So I'm really looking forward to getting her on board. And then Garrett is actually this is the environmental health intern. Our environmental health intern, we receive vector surveillance grant monies every year. And this will be the first year in a number of years where we've hired an intern to assist us with our rat control program and vector control. We're really looking forward to it. We have the intern is I don't know her name, but she's currently enrolled at Illinois State University, and we're looking forward to bringing her on board from mid-May through mid-August. And I think she'll be a valuable asset in our combat against rats and other vectors. Grant updates. So I think I mentioned this at the last meeting that we did receive, or we will be receiving, a $200,000. It's like a COVID-19 vaccination grant, or and the grant and monkeypox influenza grant. This grant period, actually, it's been updated from October 1st, 2022 through December 31st, 2023. We're going to ask for that extension. But we also expect to receive about $527,000 in grant funding from 16 grants over the next year. And add on to that another $100,000 a year if we do end up getting this new workforce development grant, which is pretty much 100% guaranteed as long as we get the application in on time. I did take an animal control ordinance amendment to the village board on this last board meeting, March 7th, that would increase dog limitations from 2 to 3 at a single family home and from 1 to 2 at a multifamily property. It also, another one of the amendments was to prohibit the use of platform feeders that would be easily accessible to nuisance species of animal, including, skunks, raccoons, really as much or more focused on our rats, because we had seen an increase in rats recently. And we do collect data that shows that bird feeding is a contributing factor to rats. A second reading of the ordinance will likely go to the village board as soon as the second meeting in March here. And if it gets passed, then it gets codified. Other updates. So Jen Davis and Rachel Blute, two Health and Human Services staff, successfully participated in the Stop the Bleed training, and they've recently they've trained the whole Health and Human Services Department. They've done some training with Skokie School nurses and employees, and the plan is at some point for them to train the Medical Reserve Corps, and for then Medical Reserve Corps volunteers to be able to go out and continue to teach this throughout the community. We continue to have our AARP tax program where we bring in qualified, certified tax professionals to assist Skokie seniors and individuals with disabilities with their taxes at the Skokie Public Library. And then the end of the declaration, I sort of already mentioned this, but we'll be continuing to offer vaccine or keeping a careful eye on it. We discussed at the last meeting regarding Medicaid and redeterminations and SNAP benefits. And we've pushed out again this week in the Skokie e-News, reminding individuals that receive those benefits to make sure they update their address with the state. That's what the state is. That's their primary ask at this point, just so that people get their redetermination letters and so they can respond to those. But another thing is just, like Dr. Lynn said, I mean, we need more than 32% of the Skokie population to be up to date on vaccines. And he did communicate they're pretty effective. So I wanted to talk a little bit tonight about the other commissions. When I say other commissions, I think there's 20 plus commissions or boards with the village, but the Health and Human Services Department is responsible for the Board of Health, or at least we're staff liaisons for the Board of Health, Commission on Family Services, and Human Relations Commission. And I wanted to provide a little bit of information on both. The Commission on Family Services, their mission is to promote emotional, social, physical well-being of Skokie's most vulnerable residents through outreach, education, and advocacy. They collect unused produce in the summer at the farmer's market. They collect clothing at the farmer's market and they get those items over to the Niles Township Food Pantry and Niles Township Community Closet. They also are planning for a Boomers and Beyond Senior Resource Fair in 2023, and they do participate in other festivals throughout the year. And then we have our Human Relations Commission, which was created to promote unity and encourage residents to work in integrated ways to strengthen the community. The purpose of that commission is to encourage understanding and respect between residents of various racial, religious, and ethnic backgrounds, and also safeguard the rights of citizens as defined by our ordinances, statutes, and constitution, and to promote the amicable settlement of disputes between neighbors. And they give out the Block Party of the Year awards, and they visit block parties throughout the year as representatives from the village, and they do offer an annual block party forum. They also participate in a number of village events annually, and they also are responsible for adjudicating the village's fair housing ordinance. So if we had a resident who felt like they were being discriminated against, there's a whole process in the ordinance where it would go to the village manager, and eventually it could end up back in front of the Human Relations Commission for review. So they would have a very important role in that, although as far as I know, over the last 5 years at least, there hasn't been anything brought to the Human Relations Commission. It may have been resolved through mediation or other means prior to getting to them. But I just wanted to fill you in a little bit on the background of them. And then I just wanted to mention that tonight, Jen and Amy did a wonderful job with their presentation on communicable disease surveillance and control, clinics and screenings. And next month, it'll either be Jen Davis or Rachel Blute will come and speak on the Medical Reserve Corps and emergency preparedness, and some of the training and deliverables with that, and on our emergency preparedness grants and what those deliverables are. And that's something that Rachel Blute currently manages with Liz Nelson, our grants coordinator. So that said, I'm going to stop sharing, and if there's any questions, I'm more than happy to answer any questions.
Mike, I don't see any.
Well, thank you.
Well, if anyone thinks of any while we're moving along, feel free to ask them. So now we're on the what I'm going to call the old business. We have been waiting for this presentation. I look forward to it. I know a lot of effort has gone into looking at the onboarding process through this onboarding subcommittee. As we discussed a number of meetings ago, there really has been no formal orientation to individuals who joined the board. And there may be individuals who are still somewhat confused. That's why we've been doing this ongoing educational program to try to understand what functions do occur under the Health and Human Services department. And I'm going to turn it over now to Heidi Dugan. You took on this task, and I know that Sybil worked with you, and I'm assuming, Heidi, you're going to be doing the presentation?
Sure. And really more of a discussion than presentation. So not a formal fireworks and circus tent atmosphere. Mike, I don't know if you want to share the document or if you'd like me to, or how you'd like to do this. Pointing at the light. Sorry, Mike. I'm happy to share.
So please share. Thank you.
Okay.
I got like 16 screens open because I'm at work.
Oh, sure.
I'm sorry. I apologize for that. I'm trying to bounce around different screens.
Not at all. Not
Go ahead
at all.
and share. Please do.
So you will see this Google Doc, and if anybody doesn't see it, please holler. I'm not monitoring the chat very closely. You have all been shared this document. I promised to do this several months ago.
and it just took me a bit. And I apologize for that. I view this as a draft, and I also view it as a springboard. This is very similar to the document that you saw a few months ago, you know, Q4 2022, I guess. I don't own any part of this. Swapna has been super helpful. Maureen Hanlon was super helpful. Sybil Yao has been super helpful. And other folks have wanted to contribute. And so this document, purely a draft, you are all, as board members, able to come in here and edit or make comments to it. If you're unable to do that, or are not comfortable maybe with Google Docs, I would be happy to have a call with you one-on-one just to make sure that you can get in and show you how to edit or make comments. I don't feel like this is the best thing we can come up with. I think all our minds will make it better. So please do, if you can, take the time to read through this and provide input or comments or edits, or it's missing this or it's missing that. So I had wondered, and I know Swapna and I have both been on the board for a while, and we talk about this, you know, over the years, every so often. Sort of having a welcome packet, and maybe this could be a model for the other commissions, I don't know. Can you all see this well enough? Should I make it larger?
Hey, Heidi, this is Mike.
Yeah.
So,
Yeah.
I can see it fine, but I wanted to mention to you that you're sort of a trendsetter, because I've been attending the human relations meetings, and at the last meeting, believe it or not, one of the members said, we really need an onboarding document. So I said, well, as a matter of fact, I said, the Board of Health is working on something, and I think once we're finished with I really think that this is sort of going to be a great template for every other board and commission in the village. So kudos to you for even thinking about this and putting this stuff together. So you're on the right track.
Super, I appreciate that. And there were good minds at work. I really appreciate conversations, you know, Swapna, about like, how do we often our comments or need for this came out of how do we be more helpful to the board? You know, coming once a month to a meeting probably isn't the only way that we can contribute. So we wondered about initially a welcome letter from you know, our chair, Dr. Lynn, and you, Mike, or whatever. We know that there's a letter that comes from the mayor's office. But even that personal welcome is valuable. We put in here what is the purpose of the board and the board's portion of the municipal code. And I should probably put a link to the municipal code here, but that's taken directly from the Skokie code. And I'm sorry to move this document around so quickly. And a little bit from the state, you know, the state law reference. I still wonder if the village has, oh dear, sorry. I'll keep my hands right here. If the village has a statement of conduct and ethics or a conflict of interest statement or something like that, if we decide we don't need it, the village doesn't have something or whatever, we just take this out. So
Heidi, they do. They
Okay.
do. And I will, I'll go back in here tomorrow, or prior to meeting, our next meeting, and I'll add that information. I'll either add a link in there or I'll make sure it gets in there.
Okay, perfect. Required training, I don't mean it as a punitive thing, but we know that all board members are required to have Open Meetings Act training. However, in talking to some of the newer board members, that isn't necessarily something that's followed up on by the village. So we could maybe help facilitate that. Mike, you shared a letter that comes from the village with the link to the training. And then the certificate, when the training is done, it's about an hour, as I recall. The certificate needs to go back to a particular person at the village. So we can provide that information here too. I don't know if because of the work that we might assist with, if HIPAA training is appropriate, or acknowledgement of it, or whatever. I know I would have found helpful an introduction to village business, either a trustee meeting or a conversation with one of our trustees, and sort of a one-on-one sit down about the Department of Health and Human Services. I think I mentioned later in this, Mike, you shared this amazing document of the myriad, like, departments, divisions, units of activity within the Department of Health and Human Services, and it's staggering. So that would be a great thing to have here too, as a great quick reference for folks. A calendar of events or opportunities for service, because it seems like occasionally you all might be able to use an extra set of hands for some things, and sometimes people need to plan for that. My own institution gives me several days off a year to do volunteer service for this kind of thing. I would love to know kind of the time of year when things are coming up that I might plan for some of that volunteer work. We talked about board members' bios and contact info. That would definitely have to be an opt-in, but all of our names as board members are already on the village website. So we could minimally link to that. I will also say that it says we have a max of 20 members, but there's 21 listed on the website right now. And it also says we're looking for one. So
I'll fix the website.
sure. And I have a former colleague who lives in Skokie who would be really, really wonderful, comes from the evidence-based healthcare arena. An onboarding buddy might be another idea. It has mattered to me when I have joined an organization and gotten a phone call or a check-in from an individual member of that organization saying, welcome, glad to have you. This is a little bit about me, the ways I've been able to contribute. What would, tell me a little bit more about yourself. So departmental contacts, that was probably in the stuff that you sent also, Mike, and I'm really sorry I couldn't put my finger on it. Your divisions and activities, which I mentioned earlier, and other important links, we can link to those specific part of the village website that is meeting minutes, agendas. And then we had some future action items, and it could be that bullet 1 is moot. Swapna and I both suddenly got super busy with work activities, and so we haven't gotten back to kind of looking at the other boards and commissions to see about onboarding, but Mike, you just addressed that for at least one of them. And I think it would be helpful to have a checklist that a new board member knows, here's the stuff that's going to happen to get you up to speed in the first 3 months that you're on the board, or the first 2 months, or the first 6 months, or whatever it is, literally a checklist that says, okay, I haven't had a tour of the department yet, but I was able to sit down with one of our trustee liaisons or whatever. And I really, truly hope that you all will be able and willing to take some time and put your minds to this also, and help make it a better, stronger, more helpful document. So, and I also want to thank my little team, Swapna and Sybil and Maureen, and, that helped kind of get this to where all of you can have something to sink your teeth into. So, thank you.
Well, thank you very much. Are there any questions for Heidi? Dr. Kumar, I think that, yes, your electronic hand is up. You have to unmute.
I said it's a great job. Thumbs up.
Well, thank you. Thank you.
I agree. It's a big effort, but it's a great start, and I'm very appreciative of all of your efforts on this behalf. Anyone else have any questions?
I just want to let Heidi know, thank you. And I will before the next meeting, I'll fill in a lot of the blanks in that document so that on the Google Doc.
I see,
Perfect.
Jennifer has her electronic hand up.
It's wonderful to be able to join in on these meetings, and that way I get a lot of information. So anybody who would love to volunteer with any of our events that are going on, please contact me directly, and then we can start that process, and I'll make sure you're on the distribution lists for volunteer opportunities. Dr. Lynn and Dr. Werner have helped. Ms. Pat Urbanis has helped. So many people have helped throughout the process, but they're part of the volunteer distribution list and get those emails. So if you'd like to be added, please let me know, and I can.
Great.
get
We
you
didn't know
included.
there was an email list. So I'll add that to the document. And maybe that could be kind of an opt-in on the onboarding, like, yes, absolutely, add me.
That would be great.
And I'd like to
Okay.
suggest, Jennifer, that maybe you put together a list of what types of events you're soliciting volunteers for.
Sure.
So everyone is on the same page.
Absolutely.
Thank you. All right.
One last comment. I am
Absolutely.
confident there are things that we didn't get on there that we should have. So if you're not wanting to fill out the whole whatever that item is, just put a note that we're missing X, Y, or Z so that we can follow up on it.
Very good.
Thank you all.
Thank you. Thank you very much. Sybil, I think you're next with an iPlan update. As was shown in the document before, that's one of the responsibilities of the Board of Health, and we're in our 5th year iPlan at the moment.
Right. So, hi, everybody. So as we talked about in a previous meeting, the iPlan is using the collective impact framework, which focuses on equity. And we did have a meeting in November that where 3 work teams were created, which was access to healthcare, access to mental health, and access to housing. And so each work group has their own meetings that are set up. The healthcare group met on Tuesday, and we had Dr. Lynn is a member of that team as well as I am. And we had a really good discussion on the fact that, there's insurance issues, there's prenatal care that we need to know more about. Seems that pregnant women are getting their care later than we would like. And also availability of appointments is a concern. And we need to have more data. We do have some data, but it needs to be stratified and more specific. So Liz Nelson and the data team provide the data for this work, and then we can make decisions based on that. So each team has to have a finished work product to present to the steering committee by the end of June. So in order to do that, we are meeting twice a month for 90 minutes. And so it's a big ask for people to take that much time, but it's really important work. So as I mentioned, the healthcare group met on Tuesday. The mental health group, I believe, met today. And I'm not sure if everybody knows, but Skokie working on affordable housing. It's now top priority. And so Liz Nelson is waiting to get some more specific information on the approach that the village is going to take on affordable housing. And then she'll be convening that work group. So as Dr. Lynn just mentioned, the work groups get their products to the steering committee, then the steering committee moves that to our group, the Board of Health, and then we need to pass it along to the village. And that needs to be done in September. So in August, we finish up, we send it to the village for September so that it can be presented to IDPH for their approval. So the mental health group is looking for a co-chair. So I don't know if anybody on the board has an interest, but Liz Nelson can be contacted if you're interested in joining any of the work groups. And we did have 2 interested Skokie residents join the Access to Healthcare team. So the information went out in the newsletter and it yielded resident interest. So I think that's very promising because we do actually have to have 51% of the team needs to be from the affected population. So we do need to engage our residents more. And does anybody have any questions? Because that's pretty much my snapshot of the report. Looks like nobody's got any questions right now. Thank you.
Sybil, thank you very much. And we will keep the board appraised because this is an ongoing effort. And I have to comment that I think the professionalism to how this is being handled is really laudatory. And so I know that a lot of effort has gone into this. And when you'll get a chance to see this, you'll, I think, share my enthusiasm for it. So we're at the point now in the meeting, Mike, that I want to solicit any public comments. And while Mike is looking at that, are there any other issues that any member of the board wants to bring before this meeting? So Mike, do we have anything?
No public comment. Thank you.
All right. So let's talk about next meeting that will occur in April. This will still be a remote meeting via Zoom. Am I correct? Mike saying yes.
Yeah. At this point, April will be remote.
Right.
And
I know that Mike has not been shy about reminding people that when it comes to May, we're going to be going live. We expect because of the changes in executive orders and public health emergency declarations. And unless the Illinois legislature or whoever's in charge of it changes the requirements of the Open Meetings Act, being remote is the exception and not the rule. And so we really have to, we're going to be looking into a little bit more about, how the village leadership at the manager and trustees and mayoral levels feels about how to conduct meetings appropriately. We will be able, we think, to accommodate those individuals that have significant reasons for not being comfortable to come to an in-person meeting. Because and Mike, step in if I'm misinterpreting anything, because we do have technology that will allow us to have what we call a hybrid meeting. But that can't be for everybody. And so if individuals are unable to fulfill this obligation, and this becomes a real burden for them personally, it may mean that they may have to consider no longer serving on the board. But but there's no means I'm putting that down as a threat. I think it's just reality. Many of us have become comfortable with the Zoomosphere, if you will, over the last 3 years, and a lot of organizations are continuing with remote meetings. There are advantages and disadvantages, but because of the Open Meetings Act, I think we're obligated to have in-person meetings. Mike, do you want to amplify my comments or correct me if I misquote anything?
So the only thing I'd add is that May 11th is when the emergency declaration ends, and May 11th is when we have our May meeting. So depending on when it ends, we'll probably plan on having it in person. And if there's anybody who's immunocompromised who can't attend the meeting, like has a legitimate reason, not because they want to eat dinner or they want to hang out at home, then we could probably accommodate them. But we need a majority of the members to attend in person to have like an official meeting. And then we can have individuals that are immunocompromised still attend via the OWL we have up in C&D, our meeting room C&D. But that's all. I mean, just encourage everyone to attend in person. I'm actually looking forward to meeting everyone. I think some of you have never met in person, so I'm really looking forward to seeing some of you again and being able to see you in person. So I'm like I said, I'm really looking forward to that. So it's going to be great.
Yeah, I share your enthusiasm, especially when we do these Zoom meetings and we realize that the majority of people have blacked out their image. So I'm still trying to connect names and faces, and so it's been a little bit of an effort. But again, I appreciate everyone's participation and input. But April will still do this via Zoom. And if we have any more information, we'll discuss it. I just want to throw this out there. And I know, as I said, Mike has been adding this to a lot of his communications with the board, as a reminder that we're anticipating a change, in how we conduct business moving forward. So again, I'll ask for any other comments, concerns, announcements. Not hearing any, I'll call for a motion to adjourn.
What about the personal statements for next month?
Okay. I don't know. Mike, has anybody stepped forward, or we have to solicit this again?
Who wants to do it next month?
I will do it.
Okay, I got Ruth Varma.
Yeah.
Who else wants to introduce themselves next month that hasn't?
Dr. Kumar, I think, put it in the chat.
Okay, got it. I need one more. One brave soul.
One bashful brave soul.
Yeah.
I
Okay,
think
we got
Heidi. Yes, I see a hand.
Heidi says she'll do it. Okay, we got Heidi. Okay, great. Okay, awesome. We got 3. We're all set.
We also have Larry, who's been.
We're not going to let Larry introduce himself anymore. He's banished.
And that's not for the minutes. Okay. Off the record. Okay. I'll go back to my question. Does anyone have a motion to adjourn?
I so move.
Patricia, so moved. Thank you. A second?
I will second it.
Second.
Okay, thank you. And we'll let you vote by how you click off.
Goodbye.
See you
Listen,
guys.
everyone be healthy and stay well and be safe.
Thank you.
Good night,
Bye, all.
everyone.